Committee will come to order. Madam Clerk, please call the roll.
You have a quorum, Madam Chair.
Thank you, ma'am. Okay, we want to start by indicating that we have 4 bills that do not belong in this committee, and those bills are House Bill 904, Delegate Hayes, House Bill 997, Delegate Fowler, House Bill 1148, Delegate King, and House Bill 1235, Delegate Witt. And so I will need a motion to have those bills referred to the Committee on Rehabilitation and Social Services. It's been moved and properly second that we will have those bills referred to Rehabilitation and Social Services, and we're going to have it in a block. We'll not do them individually, so all in favor vote aye. Madam Clerk?
Yeas 9, nays 0.
Yeas 9, nays 0, and those bills are be referred to the Committee on Rehabilitation and Social Services. We have some bills that are similar in nature, and we will indicate those as we go forward. We also have one bill that is not similar, and we will allow that delegate to have his piece, and then we'll move on with whatever disposition the committee so desires. So, we don't have any subcommittee reports this week, but I can pretty much advise you there's going to be a pretty lengthy list next week. So why don't we start with House Bill 115, and that's Delegate Hope. Well, why don't I start with Delegate Hurst and let him say his piece on his bill?
Thank you, Madam Chair, members of the committee. I have for you House Bill 648.
Please draw your attention to House Bill 648.
It is similar in nature to a bill that was
Maybe
passed by Senator Donovan. I'm not exactly sure what the Senate bill number is for council and clerk staff to be able to refer the committee's attention.
It's Senate Bill 575.
So, Madam Chair, members of the committee, this bill simply was brought by emergency department physicians who were seeking access for the prescription monitoring program through the Emergency Department Care Coordination Program. We established the ED Coordinated Care Program in 2017 to connect all emergency departments across the state so that we can look for high utilizers in the emergency room. One of the critical intents of the program was for patients to be able to have a quick view of the prescription monitoring program report as well, so that they could see someone who might have a potential issue with opioids or overprescribing of opioids, so that they have a little bit more understanding of those who are coming into the emergency department. But unfortunately, in order to ensure full compliance with the EDCC and the PMP, we actually do need a code change in order to make that happen, and so that's what House Bill 646 aims to do. Now, what's different from the House's version from the Senate's version is that the Senate's version also includes private health insurance carriers from being able to have access, or it allows them to have access to the PMP as well. And I just think that this bill is very small in its scope and its desire to solve a problem. Allowing private health insurance companies to have access to the prescription monitoring program, I think, is a little bit of the camel's nose under the tent and might not be something that we want to do moving forward to be able to give them access to that unique patient information across the board. And so that's the difference between the House posture and the Senate posture, Madam Chair.
Thank you, Delegate Hurst. Questions of the patron?
Madam Chair.
Senator Newman.
Madam Chair, I would move that we conform the two bills together. There may be some differences that could be worked out, but I know that Senator Donovan worked pretty hard on getting a version. Maybe you guys can work that out.
It's been moved in second that the bill be conformed. All in favor of that motion, please so designate on the electronic voting board. Yes, he got a second.
Madam Chair, thank you for allowing me to say my piece, and I appreciate working this issue out in conference. Thank you,
You're very
ma'am.
welcome.
12 yeas, nays, 0. 12 yeas.
12 yeas, no, 0 nays, the bill will be conformed. Okay. I have in queue, and I'm gonna go by the board since, there was a sign-up sheet. Next in line is gonna be Delegate Rush on sign-up. Okay, since it's identical and was passed out of committee, I would like for the attorney to read what those differences are. That's Delegate Rush, bill number 1568.
Madam Chair, House Bill 1568 is identical to Senate Bill 978 carried by Senator Edwards and passed out of the committee 15-0.
It has been moved and properly second that the bill will be reported. All in favor, please let it known by the sign of aye on the electronic voting board. Nays have the same right. We have bills
Yeas,
that,
13, nays, 0.
thank you, Madam Clerk. We have bills that are similar in nature, so since the patrons of some of these bills will not need to be present, I would like for our staff attorney to go through those and give us the definition of those bills, and then we'll move forward.
Madam Chair, first House Bill 115, Delegate Hope. The bill is identical to Senate Bill 120 carried by Senator Barker and passed out of this committee 15-0.
It's been moved and probably second that the bill be reported. All in favor of that motion, let it be known by voting on the electronic voting board. Madam Clerk?
Yeas, 13, nays, 0.
Yeas 13, nays 0. The bill is reported.
Next is House Bill 134, Delegate Runyon. It is identical to Senate Bill 186 carried by Senator Donovan and passed out of this committee 15-0.
It has been moved and properly second that House Bill 134 be reported. All in favor, please designate on the electronic voting board. Staff Attorney?
Yeas, 13, nays, 0.
Thank you, Madam Clerk.
Madam Chair, next is House Bill 165, carried by Delegate Hope. It is identical to Senate Bill 122, carried by Senator Barker and passed out of this committee 15-0.
It has been moved and second that the bill be reported. All in favor of reporting, please designate on the voting board. Madam Clerk?
Yeas, 13, nays, 0.
Yeas 13, nays 0. The bill is reported.
Next, Madam Chair, is House Bill 271 by Delegate Van Valkenburg. The Senate bill is 170. It was carried by Senator Locke, passed out of this committee 13-0, and is requested by Finance.
Motion, please. There's been a motion and a second that the bill be reported and referred to Senate Finance. All in favor designated by voting on the electronic voting board.
Yeas, 13, nays, 0.
Yeas 13, nays 0. The bill is reported and referred to Senate Committee on Finance and Appropriations.
Madam Chair, next is House Bill 292, carried by Delegate Van Valkenburg. It is identical to Senate Bill 221, carried by Senator Locke, passed out of this committee 15-0.
It's been moved and seconded that the bill be reported. All in favor, please designate. Madam Clerk?
Yeas, 12, nays, 0.
Yeas 12, nays 0. The bill is reported. Thank you.
Madam Chair, next is House Bill 362 by Delegate Razul. It is identical to Senate Bill 544, carried by Senator Edwards and passed out of this committee 15-0.
Been moved and seconded that the bill be reported. All in favor? Nays have the same right. Thank you. Madam Clerk?
Yeas, 13, nays, 0.
Yeas 13, nays 0. Madam Attorney?
Madam Chair, next is House Bill 365 by Delegate Carol Foy. It is identical to Senate Bill 98. It passed out of this committee 9-6.
Questions? Motion? It's been moved and second that the bill be reported. All in favor of reporting House Bill 365? Madam Clerk?
Yeas 7, nays 5.
You need to vote on
Yeas
that.
7, nays 5. The bill is reported. Madam
You need
Attorney?
to vote on that.
Madam Chair, next is House Bill
You didn't show
378,
up on
carried
the
by Delegate Rizul. The identical Senate bill is 864, carried by Senator Pillion. It passed out of this committee 15-0, and it was requested by Finance.
It has been moved and properly seconded that the bill be reported and re-referred to Finance.
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is reported and referred to Finance. Madam Attorney?
Next is House Bill 386, carried by Delegate Hope. The identical Senate bill is 245, carried by Senator Survell. It was reported from this committee 9-6.
It's been moved by Senator Locke. Second by Senator Lewis that the bill be reported. And thank you for voting on the electronic voting board. Madam Clerk?
Yeas 8, nays 5.
Yeas 8, nays 5. The bill is reported.
Madam Chair, next is House Bill 471 by Delegate Collins. The Senate bill is 540 by Senator Vogel. It passed out of this committee 15-0.
It's been moved and second that the bill be reported. Madam Clerk?
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is reported. Madam Attorney?
Madam Chair, next is House Bill 517 by Delegate Bulova. The identical Senate bill is 565, carried by Senator Edwards. It passed out of this committee 15-0.
It's been moved and second that the bill be reported.
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is reported.
Next is House Bill 570 by Delegate Guzman. The identical Senate bill is 167 by Senator Favola. It passed out of this committee 9-6.
Been moved. Second? Did I hear second? Second. It's been moved and second that the bill be reported. All in favor? Thank you.
Yeas 8, nays 5.
Yeas 8, nays 5. The bill is reported.
Madam Chair, next is House Bill 634 by Delegate LaRocque. The identical Senate bill is 249 by Senator Favola. The committee recommended continuing the bill to 2021 by a vote of 13-2.
Mr. Chairman, I move a similar motion.
It's been moved and second that the bill be reported.
No,
All in-
that it be carried over to the next session.
That it be carried, I'm sorry, that it be carried over to the next session. All in favor of that motion? Thank you so much.
Madam Chairman, did we miss 570? We did.
Yes.
My apologies.
Yeas 13, nays 0.
Thank you. Yeas 13, nays 0. The bill is reported.
Madam Chair, House Bill 648 is the one that we just addressed with Delegate Hurst. So we'll go on to House Bill 973 by Delegate Van Valkenburg. The identical Senate bill is Senate Bill 600, carried by you, Madam Chair, and it reported from Ed and Health 15-0.
Second.
It's been moved and second that House Bill 973 be reported. Madam Clerk?
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is reported. Madam Attorney?
Next is House Bill 1059 by Delegate Adams. The identical Senate bill is 264, carried by Senator Bell, passed out of this committee 15-0.
It's been moved and second that the bill be reported, designate on the voting board. Thank you.
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is reported.
Madam Chair, next is House Bill 1081, carried by Delegate Guzman. The identical Senate bill is 237, carried by Senator Barker. It passed out of this committee 13-0.
It's been moved and reported that the bill be reported.
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is reported.
Next, Madam Chair, is House Bill 1263 by Delegate Hodges. The identical Senate bill is 538, carried by Senator Newman. It passed out of this committee 15-0.
It's been moved and seconded that the bill be reported.
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is reported.
Next is House Bill 1304 by Delegate Hodges. The identical Senate bill is 830, carried by Senator Lewis, passed out of this committee 15-0.
It's been moved and a second, the bill be reported.
Yeas 13, nays 0.
Yeas 13, nays 0.
Next is House Bill 1498. The identical Senate bill is 610, carried by Senator Hanger. This bill was requested by Finance and passed out of this committee on a vote of 15-0 to 1.
It's been moved and second that the bill be reported and be referred to Finance. Thank you, Madam Clerk.
Yeas 12, nays 0.
Yeas 12, nays 0.
Newman is an aye.
It's going to be yeas 13, nays 0. The bill is reported.
Which one did I just do?
1498.
1498. Sorry. Okay. Next, Madam Chair, is House Bill 1562, carried by Delegate Head. The companion Senate bill is 633, and it was reported from this committee 15-0.
It's been moved and second that the bill be reported. Did Finance ask for this? No. Okay, it's not going to be re-referred. Okay. Thank you.
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is reported.
Madam Chair, our last identical bill is 1568, carried by Delegate Rush. The identical Senate bill is 978, carried by Senator Edwards, and reported from this committee 15-0.
It's been moved.
Second.
Second that the bill be reported.
Yeas 13, nays 0.
Yeas 13, nays 0. The bill is reported. That concludes the bills in that block. And now we're in the second block that has bills that are similar, but have some technical differences. And I do have a sign up, or do I have a sign up? Yes, the first one is going to be Delegate Van Valkenburg, and that is House Bill 273. And your bill has been requested by Finance.
Madam Chair, this is similar to Senator Stewart's bill on planning time, and I'm not 100% sure what the technical differences are.
The only technical difference for this one is the clause that the Finance Committee put on it. So,
I'm in your house.
Madam Chair,
Senator Peterson.
and we had a pretty robust discussion on this pre-crossover, and I voted against the bill because I didn't think it was honest for us to pass a bill that we had no money in the budget for. And so, you can go to Finance and we'll take it up, but we don't have any money in the budget for this bill, so just so no one's under any illusions.
Sounds good.
Madam Chair,
Senator Newman.
I agree. We did look at this. Do you have money in your budget for this?
So I'll go to my grave arguing that this doesn't need money in the budget and that local governments can find this time. Speaking as a teacher, I think that I earnestly believe that this gets put to the bottom of the pile for administrators because they don't have to focus on it, and that time is there. I know minds will differ on that, and I respect that. But I do think if they have to do it, the time will find itself.
Madam Chair?
Senator Peterson.
And I want to take advantage of your professional experience because it's one I don't have. It was the idea that if you have this planning time set aside, would you still be available to parents and teachers, or is it just basically you're isolated during that time?
Yeah, I mean, the basic gist is that teachers are getting their time taken because they're having to go to these other things, right? That maybe it's they have to go to an IEP meeting or they have to go to a staff training, and it's to get the time so that they can, it doesn't have to be individual, so it doesn't have to be isolated, right? But they're getting planning time. So that could be planning time with their peers, right? That could be planning time by themselves. But the idea is that, one of the things we talk about here, we always like to talk about teacher retention, and one of the most simple things you can do for teacher retention is give them time during the day so that they don't have to take it all home, and so that they can feel like they're ahead of their work when it comes to curriculum planning, lesson planning, grading, all that stuff. And so this is a small attempt to kind of force local governments, local administrators to prioritize this because, pay, we're gonna be arguing about pay when we're long gone. But work conditions is something we can fix.
Madam Chair,
Senator Newman.
I move that we report and re-refer to finance. I think we should treat you the same way we did ours. We'll put the clause
fine.
on it, and if you guys can work out the money, we can get there.
Your world?
You've heard the motion. It has been moved and second that the bill be reported and referred to finance. All in favor of that motion, please so designate on the electronic voting board. Has all senators voted? Madam Clerk.
Yeas 11, nays 2, abstentions 1.
Yeas 11, nays 2, abstentions 1. The bill will
right.
be reported and referred to finance.
Thank you, Madam Chair, members of the
Delegate
committee.
Van Valkenburg. Next on the sign-up sheet, let me get back to that screen. I have Delegate Boulevard.
Thank you, Madam Chair. I think that mine is almost identical, if not identical, to Senator Suderline's bill.
Yes, Madam Chair. The bill is almost identical to Senate Bill 112. There is one difference, and that is a dash between the words dual enrollment on line 69 of the bill.
Right?
Oh, yeah, Madam,
Yeah, there needs to be a debate about the dash, is that correct?
yes, ma'am.
No. The House bill is correct. There should not be a dash.
You didn't have to say it out loud.
Oh.
Madam Chairman, I move we dash to report this. Yeah.
Madam Attorney, did you make that technical correction?
If we pass this bill as is, it'll be made as is, yeah.
It has been moved and second that the bill be reported. Designate your opinion on the electronic voting board.
Thank you. I
Yeas
would make
14,
some
nays
dumb
0.
pun, but that's not going to get me anything. Thank you, Madam Chair.
You're welcome. Yeas were 14 and the nays were 0, and the bill is reported. Delegate Myers, is he here? Delegate Askew. And your bill has been requested by finance.
Yes, ma'am. Good morning, Madam Chair. How are
Good
you?
morning, Delegate Askew.
I have HB 797, and it's very similar to SB 9, I believe it's Senator Saslaw's bill. Or-
McPike.
Yeah, Madam Chair, this is very similar to Senate Bill
Excuse
392,
me.
carried by Senator McPike. The Senate bill has a "the" in it that actually does not need to be there.
Say that again, please. Okay, okay, it has been moved and second that the bill will be reported, it will be corrected, but it will also be going to finance. So the bill will be, it has been recommended the bill be reported and referred to Senate Finance. All in favor?
Yeas 14, nays 0.
Thank you, Madam Chair.
That wasn't so bad. It was just your first time here, so we just had to give you a little bit of a.
I appreciate the courtesy.
You're welcome. Is Delegate Myers here before we move from this block? Okay, well, I think Madam Attorney can speak to that, and we can continue to move on. You all know I like a rocket docket. Okay, he's on his way, so how long are we? Dun, 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 dun. Okay, well, we'll skip and come back to him because it's only technical. So in the next block, we have, House Bill 145. Delegate Simon, I saw you.
Madam Chairman.
Good morning.
Good morning. So, Madam Chairman, this bill, I think, is very similar to the bill that Delegate Boysko has that you all reported out. I think you guys amended at some point, I don't know whether it was here or on the floor, Delegate Boysko's bill, so my bill doesn't have that amendment, but I think Council's anxious to tell you about it,
Council?
so I'll let her do it.
Madam Chair, in order to conform, we would need to make 3 amendments. Some were made in committee and 1 was made on the floor. On line 25, after activities, we would strike the comma and insert and. On line 25, after events, we would strike comma and athletics. And then on line 26, after facilities period, we would insert activities and events do not include athletics.
The amendments have been moved and second, so all in favor, please let it be known by the voice vote by. Aye. Council? Okay. Did you want to make any more statements about your bill?
Madam Chairman, yeah, this is my first time before Senate Ed and Health. It only took me 7 years to get here. So I'm excited to be here for the first time. This bill, again, is similar. What this does is it requires the state Board of Education to develop a model policy for dealing with transgender students that's based on evidence-based best practices. And so, again, I would hope that we want to do that and make sure that all of our children in schools are treated the way that the science and social science suggests they should, so they can have a productive and positive school experience. And so, again, I hope that it'd be the pleasure of the committee to report the bill.
Does it get an A?
Move to report.
It's been moved. A second?
Yes, it's been confirmed.
You earned an A. Not quite. Maybe a B.
I'll take it, Madam Chairman, as long as I pass.
Yeas 9, nays 5.
Yeas 9, nays 5. The bill is reported. Thank you.
Thank you, Madam Chairman.
Mary is here? Yes. You have House Bill 611?
Yes, Madam Chairwoman.
Okay, there are some technical differences between the bills, and I'd like to have for Madam Attorney to please read those for us.
Madam Chair, there would be 2 amendments necessary to conform, and they are technical. It would just combine what is 2 sentences in Delegate Mieri's bill into 1 sentence, which is how it is in the Senate Bill 897 carried by Senator DeSteff. On line 20, after 2 years, we would strike period the and insert comma and. And then the second amendment on line 21, after with, we would strike such requirement for further training on board governance and insert this requirement.
It has been moved and second that the amendments be agreed to. All in favor, just do a voice vote. All say aye. Nays have same right. Madam Council.
That's it.
That's it?
Second.
It's been moved and seconded that the bill be reported as amended. All in favor, please designate on the electronic voting board. Madam Clerk?
Yeas 14, nays 0.
Yeas 14, nays 0. The bill is reported.
Thank you, Madam.
You're welcome. Did I see Delegate Mullen? Delegate King is here. Yes, Delegate King.
Morning, Madam Chair and Senators. I had 2 bills. I know that one of them was referred to rehabilitations. So the other one that I have in front of you is House Bill 405.
Okay, that is correct.
Yeah, and this one is similar to Senate Bill 232. So I would leave it to you all to decide what to do with this.
Okay, it is similar. Madam Attorney, could you cite for us any differences there may be in the bill?
Sure. So in your conforming packet, there is a substitute, a potential substitute for House Bill 405. Essentially, the difference is, if you look on the substitute on line 12, our bill has an and Delegate Keem's bill has an or. And then you might recall that we removed a bunch of language from the Senate bill. I think Senator Peterson may have suggested it as unnecessary. So
That's fine.
405. Second.
It's been moved and seconded that the bill be conformed.
I don't see.
Did council find any other differences? Is that it?
Right.
Okay, it's been moved and seconded that the bill be conformed. All in favor?
Okay.
Oh, I'm sorry.
Yeah.
In favor of that. Go ahead, I'm sorry.
Yeah.
Okay.
I think that I'm sorry, Madam Chair.
Okay, I have Delegate Peak in queue first, and then Senator
I want to talk
Peak,
after we
and then
conform.
Senator,
I'm waiting, I'm deferred to after we conform.
okay. Then Senator Peterson.
I think just to repeat what I said pre-cross, we don't typically put our legislative history into the code,
No, I
as
understand.
inspiring as it might be. So
Absolutely, I understand, Senator, and that was the way the bill was introduced, and I'm happy to see it where it is now.
We have a motion and a second. Okay, aye. Move to report.
Now,
House Bill
before we
405.
report, then I have a question, Madam Chair, before we
Okay.
report. So it's now conformed, correct?
Yes, it has.
All right, so I have a question on the bill.
Yes.
Madam Chair, Madam
You
Chair,
have the
Mr.
floor.
Patrick. Delegate King, when Senator Favola brought the bill, I had it in subcommittee. And my concern was the cost to the school system.
Sure.
At that time, and then I asked, and she said, well, they already supply these in the nurses station. But since then, and since it's gone through the Senate, I've been in contact with school folks who say, if when we move these into the bathroom where they're unsupervised, they're concerned about the cost going up, there'll be more usage, they're worried about waste, whatever. And then the other issue was potential liability, since they're not gonna be supervised. I guess they're gonna be there available to anyone, and tampering or whatever, and potential liability. Have you had those discussions with anyone?
Well, Madam Chair, Senator Peake, we've had some conversations on the other chamber when this bill was brought up, and our school organizations certainly did raise their concerns about the unfunded mandate part of it. And let me be absolutely clear, this is an unfunded mandate. There's no question about that. But to the extent that we have an unfunded mandate and many, many things that we're asking our schools to do, this one would be less of an impact on the financial side, because a lot of schools that already provide it, right now it's a question of, do they provide it in the nurse's room or in the bathroom? So it wouldn't be as big of a change for some. The other thing that we discussed in the House was, I know from my county in Northern Virginia, but many other counties are now doing partnerships, private partnerships, where organizations, nonprofits, and corporations are donating the products. And so the schools will then just pay for the dispensers wherever they want to put that, but the actual supply is provided by a nonprofit organization. So to the extent we can try to eliminate that, but again, since this probably going to conference, I assume, I would love to work with you and others and see if there's a way we can reduce the unfunded mandate. If there's a way we can do that, I'd be happy to work with you on that.
And yes,
Senator Peake.
Madam Chair, is there any budget amendment or anything like that on this?
Madam Chair, Senator Peake, we did not put in a budget amendment on this measure because the unfunded mandate is to the schools and localities and not to the state, so there is no impact on the states. And again, I've been working with our school divisions and others, and to try to find maybe a creative way for us to accomplish the policy goals and try to reduce the impact. Maybe there might be a way for us to bifurcate in certain levels of schools, keep it in the nurses' offices versus in the public bathrooms and such. So there might be a way for us to do that, but I thought that it might be better to do that through the conference process as opposed to taking your time today.
Senator Hashmi?
Madam Chair, I was going to state, but the delegates already stated that when Senator Boysko brought this bill forward, she spoke to the public-private partnerships that would be established, and I know we have several organizations that spoke that day and indicated that they would be willing to, or they're eager to actually work with the school systems to provide these products.
Thank you.
Thank you. We have a motion before us. All in favor? Please designate on the electronic voting board.
Thank you, appreciate it.
Madam Clerk?
Abstention, okay.
It will.
just
Right now, it's 14-1. We'll, 14-0-1.
On the electronic voting board, it reflects 14 yeas and 1 nay, but it will reflect in the record 15 yeas and.
Sure.
Was there an abstention up there?
I meant to abstain.
Okay, so it's gonna be 14
Sure.
yeas, 0 nays, 1 abstention.
Thank
Your
you,
bill is reported, Delegate King.
Thank you, Madam Chair, members.
You're welcome. I see Delegate Mullins has arrived. You have House Bill 257.
Madam Chair.
Yes, good
It's fun
morning.
to say, isn't it? Good to see you. I have HB 257, which is similar but not the same as Senator McClellan's bill that passed out of the Senate pretty successfully about a week and a half ago. This is dealing with the incident reports that school principals need to file and taking out mandatory reporting for a number of misdemeanors. Everyone through the criminal process for juveniles has discretion except for school principals and school administrators. The police officers, the intake officers, the judges, the Commonwealth's attorney, they all have discretion to be able to decide whether or not this is something that's a big deal or not a big deal. Too often now, things that would have sent you or I to the principal's office are now sending too many people to my courtroom. And so this bill is substantially similar to Senator McClellan's bill in giving that discretion to school administrators to decide whether or not to report things to law enforcement. The major exception, though, is that there are 5 misdemeanors that are not included in my bill that were included in Senator McClellan's bill. And those 5 are sexual battery, stalking, parental abduction, threats to kill a school employee, and threats to bomb a school. And so those were not accepted, given the fact that those are misdemeanors that are particularly egregious. And we thought that even if those are occurring, that those should be excluded. I would imagine maybe there are some other changes that staff or council might be able to.
Yes.
Madam Chair, I think that you summarized the differences well. There is a pretty substantial reorganization of the code section in your bill as well.
If you've ever had an opportunity to be able to read this code section, it's just a hot mess. It's really hard to read. And so we tried to just clarify it. But those are the substantial changes that are substantive, but we also tried to make it a little bit easier to read.
Thank you, Delegate King. We have members of the committee who would like to have some questions.
He has better hair. I'm fine to be Keem.
Delegate Mullen. King just left. King just left. Delegate Mullen. I am so sorry.
Stop. I would prefer to be Delegate Keem. He has much better hair.
I'm so sorry, Delegate Mullen. Can you please allow the members of the committee to ask you some questions?
Please.
Senator Peake. You're still in queue. Senator Hodgman. Senator Cosgrove.
Yes, Madam Chairman, I just want to point out a difference. What Delegate Mullen was saying, he mentioned the different people who did have discretionary authority in this, as police officers, intake officers, judges, et cetera. There's a big difference between the people that you mentioned and school administrators, okay? And that's the reason I have a problem with this bill. But that being said, I just want to point out that difference. That's all.
Thank you, Senator.
Any other questions by members of the committee? Delegate Mullen, it has been moved and second that the bill be reported. All in favor? I bid you a good day.
Thank you, Senator
Yeas
Lucas.
12,
Good to
nays
see you.
2.
You're very welcome. Yeas 12, nays 2. The bill is reported. I have a House Bill 299 on the docket. Madam Attorney, could you give me some clarification on the bill?
Sure, Madam Chair. House Bill 299 is very similar to Senator Barker's 239, which passed out. Right, am I now? Hold on, one moment. Got to my wrong. Okay, well, in order to conform this, on line 228, after or, we would need to strike the remainder of line 228 and through dentistry on line 229 and insert any other person.
Can I get a motion on that line amendment? The amendment has been moved in second. All in favor, say aye. Nays have the same right. It has been moved and seconded that the bill be reported as amended. All in favor, designated electronically.
If I can speak.
The bill is passed.
Yeas 13, nays 1.
Yeas 13, nays 1. Delegate Sickles was not here, And was that someone who
Yes,
came to speak against the bill?
I came to speak to the amendment.
And it's already passed now,
Yes,
but,
I'm sorry.
yeah, I still want to hear what you have to say.
Thank you. Conforming this the way it did, it says any other person. It means that any person on the street could carry fluoride and administer it. It needs to, pardon me, sir? Yes, and really it needed to conform the other way because it needs to say that any authorized person designated by the physician or the dentist can carry the fluoride, not any other person on the street. And the way it is written now, it means anyone can carry fluoride and administer it.
Madam Chair,
Okay, what's the disposition of the committee?
can we just hear from council? Is that correct? Will this allow anyone? And if we go the other way, will it only allow those that are designated?
It would allow anyone, but it would still have to be pursuant to, I believe, an order from the dentist or doctor.
It,
Ma'am, could you please give us your name and tell us who you're representing?
yes, thank you very much for the permission to speak, Madam Chair. I'm Barbara Allison Bryan. I'm a physician. I am the Chief Deputy of the Department of Health Professions.
Senator Donovan, could you please explain that to us?
Chairman, it was my understanding from the original bill that the intent was there had to be an order from the dentist in order for somebody to do that. I do not think there's any harm to the bill as stated, being more specific from the House. And with that in mind, Madam Chairman, having voted on the prevailing side by which we passed that bill, I move that we reconsider it.
You've heard the motion for reconsideration. All in favor, please designate on the electronic voting board.
Thank you, Madam
This is for
Chairman.
reconsideration.
And then by having voted on the prevailing side by which we amended the bill, I move that we reconsider the amendment.
You've heard the motion to reconsider the amendment. All in favor, please designate on electronic voting board.
And Madam Chairman, I now move to report the House bill as presented.
For you, Madam Chair.
Senator Cosgrove.
Thanks. I won't trespass on too much time. Just want to get this very straight. And of course, it has to be an order from a dentist. But still,
A dentist or a doctor of medicine or a doctor of osteopathy.
okay. I guess the thing is, if I'm going to my dentist and he says, hey, John, put fluoride on this kid's mouth, I could do it.
Yes. I mean, like, if you don't, I mean, it's an authorized agent of the person that we want to have this say.
All right, poor kid if I have to do it. All right, thank you.
I'm having some difficulty going forward with all of this without the patron of the bill being here.
And I'm sorry, we're talking about line 228 in the engrossed bill.
Would council perhaps reread the difference between the House bill and the Senate bill, please?
Sure. So the changes are on line 228. The House bill has language that says that a physician assistant nurse or dental hygienist or authorized agent of a doctor of medicine, osteopathic medicine, or dentistry may possess and administer fluoride, etc. The Senate bill just says any other person, but still has the requirement that they possess it pursuant to an oral or written order.
Therefore, Madam
If
Chairman,
I'm correct, it sounds like the original bill coming from the House was exactly as it should be.
yes, ma'am.
So then we need to move the report on the bill as it came from the House.
Yes, ma'am.
Without any other amendments to it.
Second.
Okay. It's been moved and second that the bill will be reported in the form that it came to us. And so all in favor of that motion, please designate. Thank you, ma'am. Glad you came forward.
And I thank you very much for your extra consideration.
Thank you, ma'am, very much.
14, nays 1.
Yeas 14, nays 1. The bill is reported. And thank you, members of the committee. That is the last bill. The committee will rise. Mayor Margaret.